Hello and welcome to Healthy Life Channel, where we explore vital topics to keep you well informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. Today, we're delving into a critical topic: the 9 warning signs of cancer that should never be dismissed. Cancer affects us all in one way or another, making it crucial to grasp its complexities. Cancer doesn't discriminate, and early detection is paramount for survival. In this video, we're providing a comprehensive understanding of these warning signs to equip you with potentially life-saving knowledge. Often, these symptoms are overlooked or mistaken for minor issues. By recognizing and comprehending these signs, you could potentially save a life, perhaps even your own. We'll dissect each warning sign thoroughly, offering valuable insights, statistics, and actionable advice. By the end, you'll be empowered to make informed decisions about your health and the well-being of your loved ones. Join us as we embark on this enlightening journey into understanding cancer's early indicators. 1. Unexplained weight loss. Sudden weight loss is a serious and often concerning symptom that could indicate an underlying health issue such as cancer. This refers to a noticeable decrease in body weight without intentional changes in diet or exercise. If someone loses more than 5% of their body weight without a clear cause within 6 to 12 months, it is typically considered significant. Weight loss associated with cancer is primarily due to the increased metabolic demands of cancerous cells. These cells multiply rapidly, consuming a large amount of the body's energy stores, leading to a drop in body weight as energy needs are not met adequately. Specific types of cancer, like stomach, lung, esophageal, and pancreatic cancers, are known for causing substantial weight loss, often before other symptoms appear. However, it's essential to note that unexplained weight loss can also be caused by non-cancerous conditions such as thyroid disorders, diabetes, gastrointestinal issues, or chronic infections. 2. Fatigue. Fatigue, characterized by profound and persistent exhaustion beyond normal tiredness, can also be a potential indicator of an underlying medical issue, including cancer. Unlike typical fatigue that improves with rest, cancer-related fatigue tends to persist and may not alleviate even with adequate sleep. The factors contributing to fatigue in cancer are complex, including the body's response to cancer cells and the immune system's efforts to combat the disease. Various cancer types, such as leukemia, are notorious for causing intense and prolonged fatigue. Additionally, cancers that have spread or affect vital organs can exacerbate fatigue. However, it's crucial to recognize that persistent fatigue can stem from non-cancerous conditions like chronic illnesses, medication side effects, stress, poor nutrition, or sleep disturbances. Seeking medical attention is essential, especially if fatigue is continuous and significantly impacts daily functioning. A thorough evaluation by a healthcare professional, including medical history, physical examination, and possibly tests or imaging, is necessary to determine the underlying cause of fatigue. 3. Changes in skin appearance. Alterations in how the skin looks can serve as significant indicators of underlying health issues, including cancer. These changes encompass a wide range of variations, such as the emergence of new moles or modifications to existing ones. These modifications may involve differences in texture, size, color, or shape. Detecting any skin changes that could be linked to skin cancer is a top concern. Skin cancers like melanoma, basal cell carcinoma, and squamous cell carcinoma often manifest as noticeable changes in skin appearance. These changes can include alterations in pigmentation or irregularities in the texture or border of a mole. Early detection of skin cancer is crucial as it can significantly improve treatment outcomes. Key steps in this process include regular self-examinations and seeking professional medical evaluation for any concerning skin changes. 4. Hoarseness or persistent cough. Another symptom that may indicate an underlying health issue, including cancer, is a chronic cough or hoarseness. Chronic coughing refers to a persistent cough that lasts for an extended period, often weeks or months, without improvement. Hoarseness involves a noticeable change in the voice's pitch or tone, resulting in a scratchy or raspy sound. While chronic coughing or hoarseness can be associated with lung cancer, it's essential to note that these symptoms can also indicate other types of cancer, such as esophageal, laryngeal, or throat cancers. Additionally, lung cancer or tumors near the lungs can cause chronic coughing. However, it's crucial to understand that chronic coughing or hoarseness is not always indicative of cancer and can also be caused by non-cancerous conditions like allergies, respiratory infections, or smoking. Seeking medical attention is vital, especially if these symptoms persist, as they can be indicative of serious health issues. 5. Changes in bladder or bowel habits. Deviations from normal patterns in bowel movements or urination can signal an underlying medical condition, potentially including cancer. Persistent constipation, characterized by difficult or infrequent bowel movements, or persistent diarrhea with frequent loose stools, are noticeable changes in bowel habits. Additionally, the presence of blood in the stool, either visible or detected through testing, raises concerns about gastrointestinal issues like colorectal cancer. Changes in bladder habits may involve increased or decreased urination frequency, alterations in urine color or appearance, and the presence of blood in the urine, hematuria, or a cloudy appearance. These changes could indicate urinary system problems such as bladder cancer. It's important to note that altered bowel or bladder habits can also be influenced by non-cancerous factors like dietary changes, infections, medications, or hormonal fluctuations. Seeking medical assistance is crucial, particularly if these changes persist, as they may require further evaluation and management. 6. Difficulty with swallowing. Difficulty with swallowing, also known as dysphagia in medical terminology, is a concerning symptom that might indicate an underlying medical condition, including cancer. Dysphagia refers to significant and persistent difficulty or discomfort while trying to swallow food or liquids. It's essential to understand that although difficulty swallowing can signal esophageal or throat cancer, it can also be a symptom of various other cancers. Tumors pressing against the esophagus or nearby areas can also cause swallowing difficulties. This symptom can have diverse causes, such as the narrowing or obstruction of the esophagus due to cancer, inflammation, or irritation caused by cancerous growths. It's crucial to note that non-cancerous factors like esophageal strictures, neurological issues, or certain medications can also lead to swallowing problems. 7. Experiencing pain in the abdomen. Experiencing pain or discomfort in the abdomen refers to any unease or pain in the region between the chest and the pelvis, known as the abdomen. This symptom can indicate several types of cancer, highlighting the importance of early detection for timely medical intervention. For instance, ovarian cancer is often associated with abdominal pain, particularly lower abdominal discomfort accompanied by bloating. This pain may vary in intensity and persistence, often felt deeply within the pelvis. Another cancer that can cause abdominal pain is pancreatic cancer, characterized by a deep, gnawing ache that may radiate to the back, intensifying as the cancer progresses. However, it's essential to recognize that abdominal discomfort can also stem from non-cancerous sources like dietary factors, food intolerances, infections, or gastrointestinal conditions such as gastritis or irritable bowel syndrome, IBS. 8. The presence of bulge. The presence of an unusual bulge or swelling refers to an abnormal enlargement or mass in a specific area of the body, which is not typically observed. This anomaly could indicate an underlying medical condition, including cancer. The characteristics of these swellings or lumps, such as size, texture, and location, can vary depending on the type and stage of cancer. They may or may not be visible externally and could be painless or uncomfortable. It's important to note that non-cancerous conditions like cysts or infections can also lead to unusual swellings or lumps. Notably, noticeable enlargements or lumps may result from benign growths as well. 9. Changes in taste. Changes in taste perception or difficulty consuming food can signal an underlying health issue, including the potential for cancer. Such alterations in appetite or eating habits can disrupt normal patterns, especially when cancer affects the digestive system or other vital organs. This disruption may manifest as decreased appetite or difficulties in swallowing. For instance, cancers affecting the stomach, pancreas, or esophagus can induce pain or discomfort during meals, leading to reduced food intake. Additionally, specific cancer types or treatments can impact taste perception, causing food aversions or a diminished enjoyment of eating. Conversely, certain malignancies may trigger an increase in hunger due to altered metabolism or hormone imbalances. Any noticeable and unexplained changes in eating patterns or appetite should prompt further investigation by a medical professional to exclude or address potential underlying conditions such as cancer. These 9 critical indicators of cancer should never be ignored, and immediate medical assistance is imperative if you experience any of these symptoms. Early detection is key to successful cancer treatment, as it significantly enhances the chances of survival. Remaining vigilant and recognizing these symptoms promptly increases the likelihood of detecting cancer in its early stages. It's essential to avoid waiting for symptoms to worsen and to seek medical attention promptly if you have any concerns. If you find these insights helpful, please support by engaging with this content, such as liking, following my channel, and enabling notifications for updates on the latest information about nutrition and health. Your support encourages the dissemination of essential information.